Have you ever thought that a simple vitamin, one that millions of people take daily, could actually pose a serious health risk? Today, we're delving into a surprising and alarming story of a 55-year-old woman who faced a life-threatening situation, all because of a vitamin she thought was safe. Stick around to find out what happened and how you can protect yourself from making the same mistake. A 55-year-old woman was suddenly rushed to the emergency room. She had a known history of kidney disease, but that day her condition took a drastic turn for the worse. She arrived at the hospital extremely weak with a dangerously slow heart rate, significant body swelling, and an alarmingly low body temperature of 33.9 degrees Celsius. For context, the normal body temperature is around 37 degrees Celsius, so it was clear something was very wrong. Given her kidney disease, doctors quickly checked her creatinine levels, which is a waste product that healthy kidneys usually filter out of the blood. The results were shocking. Her serum creatinine levels had skyrocketed to 35.30 milligram per deciliter, a massive increase from just 2 months earlier. Her kidneys had nearly stopped working, and she wasn't producing any urine. This rapid deterioration meant toxic substances were building up in her body, posing a severe risk to her life. Understanding the urgency, the medical team immediately transferred her to the intensive care unit and started her on dialysis the same day. Dialysis is a critical treatment that mimics the filtering function of the kidneys, removing waste and excess fluids from the blood. Doctors were perplexed by her rapid kidney failure and conducted a series of tests to uncover the cause. After a thorough investigation, they pinpointed an unexpected culprit, a common vitamin C supplement that many people take every day. This seemingly harmless supplement had caused significant damage to her kidneys. This case is a stark reminder that it's not just prescription medications that can be dangerous. Over-the-counter vitamin supplements, which are often assumed to be completely safe, can also pose serious health risks. This woman's experience underscores the importance of being cautious with any supplement you take. There is another incident that sheds light on the hidden dangers of overusing vitamin supplements. In 2023, a TikTok influencer who was bravely fighting colon cancer shared her unexpected health scare. In an effort to boost her immunity and battle the cancer, she began taking extraordinarily high doses of vitamin C, that is 50 grams every day. To put that into perspective, that's a staggering 50,000 milligrams, while the recommended daily intake for women is just 75 milligrams. This influencer's story took a surprising turn when she developed painful kidney stones. She had been unaware that such a high intake of vitamin C could lead to this problem. Her story went viral, catching the attention of many, including medical professionals. Dr. Ashley Winter, a board-certified urologist and chief medical officer at Odella Health, took to social media to explain the dangers of excessive vitamin C intake. In a post on X, formerly known as Twitter, she clarified why overloading on vitamin C is not only ineffective for immune support, but also potentially harmful. Dr. Winter explained, "Taking too much vitamin C does nothing beneficial for your immune system because your body just eliminates the excess through urine. Once in your urine, vitamin C transforms into oxalate, a key component in forming kidney stones. Essentially, you're setting yourself up for developing kidney stones." This incident highlights a critical takeaway. More is not always better, especially when it comes to supplements. While vitamins are essential for our health, taking them in excessive amounts can lead to serious health issues. The body can only utilize a certain amount of vitamins, and anything beyond that can cause harm. So what should you do to stay safe? Always follow recommended guidelines for vitamin intake and consult with a healthcare professional before making any significant changes to your diet or supplement routine. Your health and well-being are paramount, and it's important to make informed decisions. Now let's see the list of vitamins that can destroy your kidneys. Just a quick reminder, the information provided in this video is for educational purposes only and is not intended as a substitute for professional medical advice. Please note, every piece of information here has been authenticated by a cadre of professional researchers. Okay, let's see. The number one vitamin on our list is vitamin D. Excessive intake of vitamin D can pose significant risks to kidney health, particularly in individuals with chronic kidney disease or CKD. The primary concern is hypercalcemia, a condition characterized by elevated levels of calcium in the blood. When vitamin D is taken in high doses, it increases calcium absorption in the gut, leading to an accumulation of calcium in the bloodstream. This surplus calcium can then deposit in the kidneys, causing nephrocalcinosis, a condition where calcium deposits form in the renal tissue, potentially leading to renal failure. For patients with CKD, managing calcium and phosphorus levels is already challenging. Elevated calcium levels can exacerbate these difficulties, contributing to vascular calcification and worsening kidney function. A study published in the Al-Azhar Medical Journal in 2022 found that high doses of vitamin D supplements could accelerate kidney function decline in CKD patients by promoting hypercalcemia and subsequent calcification in the renal tissues. This research underscores the delicate balance required in managing vitamin D intake among individuals with compromised kidney function. Another study in 2023, featured in the Handbook of Dialysis Therapy, reinforced these findings by showing that CKD patients with high vitamin D levels had an increased risk of mortality due to cardiovascular complications associated with hypercalcemia. These studies highlight the importance of cautious vitamin D supplementation, especially in populations vulnerable to kidney issues. The recommended daily intake of vitamin D varies by age and gender. For men and women up to the age of 70, the recommended amount is 600 IU, or international units, per day, increasing to 800 IU for those over 70. Children from birth to 12 months should receive 400 IU daily, while those aged 1 to 18 years should aim for 600 IU. In conclusion, while vitamin D is crucial for bone health and overall well-being, its supplementation must be carefully monitored to avoid adverse effects on kidney health. Individuals, particularly those with CKD, should consult healthcare providers to determine appropriate dosages and prevent potential complications. Next, number 2. Vitamin B6. While essential for many bodily functions, excessive intake of vitamin B6, pyridoxine, can pose significant risks, particularly for individuals with chronic kidney disease. High doses of vitamin B6 can lead to neuropathy and have been implicated in exacerbating kidney issues. The mechanism involves the conversion of pyridoxine to its active form, pyridoxal phosphate, which is critical for enzyme functions in amino acid metabolism. However, at toxic levels, it can cause sensory neuropathy, and emerging research suggests potential nephrotoxic effects. For CKD patients, the kidney's impaired ability to filter waste can exacerbate the accumulation of vitamin B6 metabolites, potentially leading to toxicity. This is particularly concerning given that individuals with CKD already face a higher risk of developing neuropathy due to uremic toxins. A 2004 study published in the Journal of Applied Toxicology explored the effects of high-dose vitamin B6 supplementation in CKD patients. The study found that elevated levels of pyridoxine correlated with worsening renal function and increased markers of kidney damage. Another study from 2023 in the Nutrients highlighted similar findings, showing that CKD patients with high pyridoxine levels experienced accelerated progression of kidney disease compared to those with lower levels. The recommended daily intake of vitamin B6 varies by age and sex. For adult men and women aged 19 to 50, the recommended amount is 1.3 milligrams per day. Men over 50 should aim for 1.7 milligrams, while women over 50 should aim for 1.5 milligrams daily. For children, the recommended intake is lower, 0.5 milligrams for ages 1 to 3, 0.6 milligrams for ages 4 to 8, and 1.0 milligrams for ages 9 to 13. Adolescents aged 14 to 18 should consume 1.3 milligrams and 1.2 milligrams daily. In conclusion, while vitamin B6 is vital for health, it is crucial to adhere to recommended dosages, especially for CKD patients, to avoid potential kidney damage. Regular monitoring and consulting healthcare providers before starting or adjusting supplements can help mitigate these risks. Next, number 3, vitamin A. Overconsumption of vitamin A can pose significant risks to kidney health, particularly in individuals with chronic kidney disease. The main danger lies in its potential to cause hypervitaminosis A, a condition characterized by an excessive accumulation of vitamin A in the body. This can lead to various adverse effects, including kidney damage. The process begins with the liver, where vitamin A is stored. When intake exceeds the liver's storage capacity, vitamin A is released into the bloodstream in excessive amounts. High levels of vitamin A in the blood can cause oxidative stress and inflammation, which are harmful to kidney tissues. Additionally, excessive vitamin A can lead to hypercalcemia, an elevated level of calcium in the blood. This in turn can result in the formation of kidney stones and calcification of kidney tissues, exacerbating kidney damage. A 2018 study published in the Annals of Clinical and Laboratory Science highlighted the detrimental effects of excessive vitamin A in CKD patients. The research found that elevated serum retinol levels were associated with an increased risk of progression to end-stage renal disease. This study underscores the importance of monitoring vitamin A levels in individuals with compromised kidney function. Another study from 2016, featured in the Clinical and Translational Science, investigated the impact of high vitamin A intake on renal health. The findings revealed that chronic high intake of vitamin A led to significant renal impairment and increased the severity of kidney fibrosis in experimental models. These results provide further evidence of the toxic effects of vitamin A on the kidneys, particularly in vulnerable populations such as CKD patients. To mitigate these risks, it is essential to adhere to the recommended dietary allowances for vitamin A. For adult men, the RDA is 900 micrograms per day, while for adult women, it is 700 micrograms per day. For children, the RDA varies with age, ranging from 300 micrograms per day for infants to 600 micrograms per day for children aged 9 to 13 years. In conclusion, while vitamin A is crucial for overall health, excessive intake can be harmful, especially for individuals with CKD. It is important to follow recommended guidelines and consult healthcare providers to ensure safe and appropriate vitamin A consumption. Next, number 4, vitamin B12. High doses of vitamin B12, although generally considered safe, can pose risks to individuals with chronic kidney disease. Vitamin B12 is crucial for nerve function, DNA production, and red blood cell formation. However, in CKD patients, impaired kidney function affects the metabolism and clearance of various substances, including vitamins. One of the concerns with excessive vitamin B12 intake in CKD patients is its impact on serum levels and the body's ability to excrete it properly. The kidneys play a vital role in filtering out excess nutrients and waste products from the bloodstream. When kidney function is compromised, these substances can accumulate, leading to potential toxicity or adverse effects. A study published in the journal BMC Medicine in 2020 highlighted the complexities of vitamin B12 metabolism in CKD patients. Researchers found that high doses of vitamin B12 could lead to increased levels of methylmalonic acid and homocysteine, both markers of B12 activity and metabolism. Elevated levels of these compounds are associated with an increased risk of cardiovascular disease and may further complicate the health of CKD patients. Another study from 2023, featured in the Nutrients, examined the correlation between high vitamin B12 levels and mortality rates in CKD patients. The findings suggested that elevated B12 levels might be linked to higher mortality rates, indicating the need for careful management of vitamin intake in this population. For the general population, the recommended dietary allowance for vitamin B12 is 2.4 micrograms per day for adults. This includes both men and women. For children, the RDA varies by age: 0.5 micrograms per day for infants, 0.9 micrograms for toddlers, 1.2 micrograms for children, and 1.8 micrograms for older children. In conclusion, while vitamin B12 is essential for many bodily functions, its management in CKD patients requires careful consideration. Oversupplementation can lead to harmful effects due to the kidney's reduced ability to process and excrete excess amounts. Therefore, CKD patients should consult their healthcare providers to tailor their vitamin intake to their specific health needs. Next, number 5, alpha tocopherol or synthetic vitamin E. Alpha tocopherol, commonly known as synthetic vitamin E, poses potential risks to kidney health, particularly in individuals with chronic kidney disease. This synthetic form of vitamin E is often taken as a supplement for its antioxidant properties, but excessive intake can lead to adverse effects. The primary concern with high doses of alpha tocopherol is its impact on kidney function. Excessive vitamin E can exacerbate oxidative stress rather than mitigate it, leading to potential damage. The kidneys, which play a crucial role in filtering and excreting waste products from the blood, can be negatively affected by this increased oxidative stress. For CKD patients whose kidneys are already compromised, the additional burden can accelerate kidney damage and progression of the disease. A study published in the journal Frontiers in Physiology in 2023 highlighted the adverse effects of high-dose vitamin E on kidney function. The research indicated that patients with CKD who took high doses of synthetic vitamin E experienced worsening kidney function, characterized by increased serum creatinine levels and reduced glomerular filtration rates. These findings underscore the importance of cautious vitamin E supplementation in CKD patients. The underlying process involves the metabolism of alpha tocopherol in the liver, where it is converted to various metabolites. These metabolites can exert pro-oxidant effects in high concentrations, leading to cellular damage and inflammation in the kidneys. Additionally, excessive vitamin E can interfere with vitamin K-dependent processes, increasing the risk of bleeding complications, which can further stress the kidneys. The recommended daily allowance for vitamin E varies by age and sex. For adult men and women, the RDA is 15 milligrams or 22.4 IU. For children, the RDA depends on age, 6 milligrams or 9 IU for ages 1 to 3 years, 7 milligrams or 10.4 IU for ages 4 to 8 years, and 11 milligrams or 16.4 IU for ages 9 to 13 years. Given these risks, it is essential for individuals, particularly those with CKD, to adhere to recommended dosages and consult healthcare professionals before starting any new supplement regimen. This approach ensures that they receive the benefits of vitamin E without risking additional kidney damage. Next, number 6, vitamin C. When it comes to maintaining optimal health, it's crucial to be aware of the potential risks associated with excessive intake of certain vitamins. A prime example is vitamin C, a nutrient lauded for its immune-boosting properties. However, taking it in very high doses can be hazardous, particularly to the kidneys. The process begins when the body metabolizes vitamin C, converting it into oxalate. Under normal conditions, oxalate is excreted in urine without issue. However, when excessive amounts of vitamin C are consumed, the concentration of oxalate in the urine increases significantly. This heightened level can lead to the formation of oxalate crystals, which can accumulate and form kidney stones. These stones can cause severe pain and obstruct the urinary tract, leading to further complications such as infections or impaired kidney function. Recent studies highlight this risk. For instance, a 2020 study published in the journal Pediatric Nephrology found a clear association between high vitamin C intake and an increased risk of kidney stones. The research demonstrated that individuals consuming large doses of vitamin C had a significantly higher incidence of kidney stone formation compared to those with lower intake. Another study in 2021 published in the BMC Nephrology corroborated these findings, emphasizing the need for caution among those prone to kidney stones. To prevent such adverse effects, it's important to adhere to recommended daily allowances. For men, the advised amount is 90 milligrams per day, while women should aim for 75 milligrams daily. For children, the recommended intake varies with age. 15 milligrams for those aged 1 to 3 years, 25 milligrams for ages 4 to 8, 45 milligrams for ages 9 to 13, and 65 to 75 milligrams for teenagers. These guidelines help ensure that the beneficial effects of vitamin C are harnessed without crossing into harmful territory. In conclusion, while vitamin C is essential for health, moderation is key. Overconsumption can lead to serious kidney issues, making it imperative to stick to recommended dosages and consult healthcare providers before making significant changes to dietary or supplement routines. Next, number 7, vitamin K. Understanding the potential dangers of vitamin K, especially in synthetic forms like vitamin K3 or menadione, is crucial for maintaining kidney health. The synthetic version of vitamin K has been shown to have nephrotoxic effects, meaning it can damage the kidneys. When ingested in high amounts, vitamin K3 can cause oxidative stress and cellular damage in the kidneys, leading to impaired renal function. The process begins with the metabolism of vitamin K3 in the liver, where it generates reactive oxygen species. These ROS can cause oxidative damage to kidney cells, leading to cell death and inflammation. Over time, this oxidative stress can impair kidney function, potentially leading to chronic kidney disease or acute kidney injury, AKI. A study published in the Journal of the American Veterinary Medical Association highlighted the adverse effects of excessive vitamin K3 intake on kidney health. Researchers found that high doses of vitamin K3 led to significant increases in oxidative stress markers and kidney damage in animal models. The recommended dietary intake for natural forms of vitamin K, K1 and K2, is considerably lower than the amounts that have been associated with toxicity. For men, the recommended amount of vitamin K is 120 micrograms per day, while for women, it is 90 micrograms per day. Children's requirements vary by age. Infants need about 2 to 2.5 micrograms, young children around 30 to 75 micrograms, and teenagers approximately 75 to 120 micrograms per day. These recommended amounts focus on vitamin K1 and K2, which are generally safe and essential for blood clotting and bone health. Given the potential risks, it is important to avoid excessive intake of synthetic vitamin K3. Sticking to recommended daily values and choosing natural forms of vitamin K can help protect your kidneys and overall health. Always consult with a healthcare provider before making any significant changes to your supplement regimen, especially if you have existing health conditions or are taking medications. And that's it for today's video on common vitamins that can destroy your kidney. We hope you found this information eye-opening and helpful. Are you taking any of these vitamins? And were you aware of these dangers? It's crucial to be informed about what you're putting into your body, especially when it comes to supplements that can impact your kidney health. If this video was helpful, then kindly type yes in the comment box. Your feedback motivates us to produce more content like this and keep you informed about important health issues. Don't forget to like, share, and subscribe to our channel for more health insights and tips. Stay safe, stay healthy, and we'll see you in the next video.